Hello, good morning, good afternoon, good evening, wherever you're watching me from. My name remains Olayinka, and I'm one of the members of the Enablers Diaspora Grassroots Support Outreach. We're a voluntary organization, so we support vulnerable people, we support the homeless. So that's me in a nutshell, and that's what my organization does. So I'm here to talk about sleep. What is sleep? Why do we sleep? The benefits of sleeping. When we don't sleep, what happens? How does sleep affect our health? So I'm going to cover all this topic. So what is sleep? Very easy. Sleep is when we close our eyes and we go into that state of unconsciousness. So when we go into that state of unconsciousness, we don't know what is happening around us. We just sleep. Isn't that scary? So good quality sleep is very important for our health and our well-being. If we have poor quality sleep, it affects every organs in our body. It affects the kidney, the heart, the immune system. We get a lot of infection if we don't sleep well. Poor quality sleep is very dangerous to our health. Sleep is very important, just as eating and drinking is important for survival. Sleep is also important for survival. Sleep, we have 4 to 5 different stages of sleep, but I will only discuss 2 important ones. So we have the rapid eye movement sleep. With the rapid eye movement sleep, this is the active stage of our sleep, and this is when we have a light sleep, the beginning of our sleep. Studies have shown that during the rapid eye movement sleep, the heart rate, the blood pressure is similar to when we are awake. But the stage 2, which is the non-rapid eye movement sleep, is when we go into a deeper sleep. And when we go into a deeper sleep, there are a lot of activities going on. Our brain is still active, but there are a lot of activities, a lot of benefits with the deep stage sleep. So with the deep stage sleep, which is the second stage, that's when, our heart beats, our breathing, our muscles relax. The body temperature drops. The rapid eye movement stops. In fact, some books describe it as that the upper limb and the lower limb gets paralyzed, temporary paralysis. Isn't that scary? And then most dreams happen in the rapid eye movement stage and also in the non-rapid eye movement stage. So how much sleep do we need? So the scientists, the NHS says that 0 to 3 months old babies will need about 14 to 17 hours sleep. Children 1 to 2 years will need 11 to 14 hours sleep. Yes. 3 to 5 years will need 10 to 13 hours sleep. 6 to 12 years will need 9 to 12 hours sleep. And then teenagers 13 to 18 will need 8 to 10 hours sleep. Now we adults, we need 7 to 8 to 9 hours sleep. And then when do we sleep? What is the best time to sleep? Sleeping before midnight is very crucial for our health and mental health well-being. Studies have shown that sleeping between 10 p.m. to 2 a.m. is when we have the repair of our tissues, our bones, our kidneys. This is when our immune system gets stronger to fight infection for us. This is when our cells produce new cells for our brain function. So it's very important that we sleep before midnight. I know some people, 12 midnight, they're still scrolling on their phone. No, that is not good. That is not good for our mental health. It's not good for our health. So we need to stop these habits. Your bedroom is only for you to have a good sleep. Now, we have so many factors that can affect our sleep. We have medical conditions. Some people have arthritis. So the pain from arthritis may disturb their sleep. Some people have thyroid disease. It can disturb their sleep. Breathing problem like sleep apnea can disturb the sleep. So thereby, it can cause poor sleep, or can cause lack of sleep, can cause insomnia, which is lack of sleep or not getting enough sleep. Breathing problem can cause it, which is not, which is not our fault. So see your GP if you have those conditions. Then we have menopause, the hot flushes, the sweating, can keep you awake. Thyroid disease can cause it. So this condition, please see your GP to get the best treatment. Screen time can cause it. Like I said, your phone, your laptop, the TV, the blue light from the screen can delay your sleep because the blue light goes straight into your eyes. And when it goes into your eyes, it stimulates your eyes. It keeps you awake. So it will disturb your sleep. And we all need those benefits of having a good quality sleep. So that's factor that can affect your sleep. Now, lack of sleep or not getting enough sleep, like I said, is damaging to the health. It can cause weight gain. It can cause high blood pressure. It can cause diabetes. It can cause cardiovascular disease affecting your heart. It can cause depression in some people. Anxiety level, your stress level goes up. It can make you very, very irritable. Some people will get to work and they just snap at any little thing and you wonder why. It could be because they've not had enough sleep. And even in children, if they don't have enough sleep, they get very irritable. It can cause memory loss. It can cause language difficulty in older women, in older people. They have the risk of falling. They can fall so many times. So poor memory, mood swing. It can cause you difficulty to concentrate. So the sciences and the book says better sleep leads to longer life. So when you have good quality sleep, your health is improved, your mental health is improved, your, even the social life is improved. So now, getting good quality sleep, the benefits of good quality sleep. Number one, it improves our mental health. You have good memory, you have clarity of mind, you can think fast, you are able to discuss, mood. It will improve your mood. Your immune system is able to fight your infection. It repairs the organs in your body, the bones, the muscles, and even new cells are being produced. We need new cells in our brain, in our body. So there are so many advantages of having a good night's sleep. It's very important, and we sleep at the right time. So now, tips to help us have a good sleep. Number one is having a routine. Establish a bedtime routine is very important. You must have a bedtime and a wake-up time. Go to bed at the same time, wake up at the same time. That can help to improve your sleep. Turn off all gadgets. No laptop, no phone, no TV. At least 2 to 3 hours before bedtime. No drinking of coffee. So abstain from caffeine. Don't drink caffeine at least 2 to 3 hours before bedtime. Avoid having heavy meal before bedtime. I know some people like their swallow, pounded yam, eba. No, not before bedtime. Because it can affect your digestive system, especially if you have problem with indigestion. Even if you don't have problem with it, can cause indigestion. It can affect your metabolism, that is your digestive system. And then also you can play soft, relaxing music that can help you to sleep better. Your relaxation technique, breathing exercise. You take a deep breathing in and then you release it slowly. Take a deep breath, so that can help you to relax. Breathing exercise, taking regular exercise during the day, not 3 to 4 hours before bedtime. Regular exercise during the day, or the meditation as well. It will help the body and the mind to relax and relieve you from anxiety. So those are the tips for good quality. If you want a good quality sleep, and if you want to have a good health, and if you want to live longer, please have a bedtime routine. Stay away from your phone. not scrolling on your phone when it is bedtime, looking at all those content online. We need to do things at the right time. And then, see your GP if you're having like insomnia, which is lack of sleep or not getting enough sleep. If you've had it for a long time, you need to see your doctor. You probably need some prescribed medication to help you sleep. And then when they now give you a prescribed medication, try not to stay on it for a longer period of time. Because when you stay on it for a longer period of time, it have so many side effects. So many side effects from those medications. Try to stay away from buying over-the-counter tablets. See your GP before you take any tablets at all. And then you can use some herbal tea as well, like chamomile tea, like lavender tea, passion flower tea. They are all good. It promotes relaxation and it reduces your anxiety level. And it's best to consume this tea at least 60 minutes before bedtime. It will improve your sleep. So, GP prescribed medication, when you are on it for too long, it can cause dependency, which means you just depend on it. Without it, you cannot sleep. And which is not good for our mental health. It's not good for our health at all. It can cause hangover as well. It can cause dizziness. It can cause headache. It can cause poor memory when you're on those tablets for a longer period of time. So please always speak to your doctor before starting any sleeping medication, especially if you have other health conditions. So remember, better sleep, longer life. Thank you for listening. Bye.